everyone, and welcome to the Learn With Me series. I am Nurse Patience Ibaso Achiche, and today we will be talking about safe handling of chemotherapy medications. Remember, this program is brought to you by Set 18 Oncology Nurses in Training, National Hospital Abuja. We do well to bring you information regarding cancer and the oncology space. Today I won't be doing this alone. As usual, I always have somebody in the studio. I'm here with a colleague of mine, my friend anyway, very annoying friend, but she's a sweet nurse too. She's no other person but Nurse Gift. Nurse Gift, you're so much welcome to the hub.
Thank you. Good afternoon, everyone.
Yeah, can we kindly meet you, please?
All right. I am Nurse Isaac Gift Ogenebreme. I'm a registered nurse and a student oncology nurse in training.
Okay, so Nurse Gift, our topic for today is safe handling of chemotherapy medications, and this is not only for the patients but the relatives and the healthcare professionals. But before we go into the topic in details, can you kindly give me your own definition of cancer, your own perception? What do you feel cancer is? What do you see cancer as? Nurse, please describe cancer as the new malaria in town. And other people have given their own definitions of cancer. So this is of the dictionary definition. What do you see cancer as?
All right. Cancer is an uprising.
Okay.
Very uprising, should I say, trend of disease that's currently in our society. And then due to a lot of misconceptions and then false beliefs, I feel that cancer is really nothing serious if well treated and maintained. If you are following the due processes, taking your medications, following your health instructions, I'm telling you, cancer is really not a big deal the way the society are putting it as.
You're one person who have given me something to be calm about. So cancer is not a big deal.
Yes.
Okay, and Nurse Kamal used to say cancer is not a death sentence. So Gift is saying cancer is not a big deal. So if you have cancer, it's not a big deal. It's something we can attend to. Thank you so much, Nurse Gift.
You're welcome.
So to the topic of the day, which is safe handling of chemotherapy medication, I would like you to take us one step at a time. What exactly are chemotherapy medications, and how can you give us some examples of chemotherapy medications?
All right. Chemotherapy drugs, they are cytotoxic drugs. Cytotoxic meaning that the cancer, they attack the cells. So, but the cells in particular are the cancer cells. So chemotherapy are cytotoxic drugs that attack these growing cancer cells in an individual body. Okay, so we also have different types. They are classified based on their divisions on the cell cycle. So we have the cell cycle specific and the non-cell cycle specific cancer medications. For the cell cycle specific medications, those are the drugs that attack the development of these cancer cells at various stages of their development. For their development, they have different phases. We have the anaphase, we have the telophase, we have so many phases, and so these drugs, they affect it at each point of these divisions. Unlike the non-specific cell cycle development cancer medications, they can affect at each of the phase. It can affect the metaphase, it can affect the telophase, or any phase at all. Also, we also have different classes. We have the taxanes, we have the vincristines, plant alkaloids, and we also have medications like the cyclophosphamide, we have vincristine, doxorubicin, and so many other classes of these drugs.
Okay, so who are those people at risk for chemotherapy medication negative effects? Who are those people at risk?
Okay, the nurses, the doctors, the patient themselves, their relatives, and also the cleaners at the hospitals are all at risk for mishandling of these chemotherapy drugs.
So how do you advise that chemotherapy medications be handled?
Okay, there are so many policies and guidelines that have been put in place for the doctors, the health practitioners, the patients, and also their relatives, as well as other non-medical staffs in the hospital to follow during the prescription or administration of this medication. So we strongly advise, first of all, on personal hygiene and the use of PPE, which are personal protective equipment. These are the gloves, aprons, and also many more equipments used during administration of this medication to protect the health workers giving the medications and also the patients and their relatives.
So, are there oral chemotherapy medications?
Of course, there are oral medications of chemotherapy. We have cyclophosphamide, for example. There's an oral for it, and also inotuzumab. There's also an oral for it.
I remember even oral capacitadine. Okay,
Yes.
so if a patient, an oncology, a cancer patient, has been discharged home and has some oral chemotherapy medication to take, what advice do you give to the family members? What advice do you give to the caregivers who are caring for these people on the handling of this chemotherapy medication?
All right. Since they are going home before discharge or before leaving the hospital, we the nurses we always have what we call education, patient and relative educations. So these are the strict guidelines that they should follow on administering these medications at home. So first of all, we always encourage hygiene. There should be proper hand hygiene, in the sense that wash your hands before and after the administration of these medications and following strict prescriptions. Also, always try to observe your patient or your relative for side effects, because this cancer the medications, we have some side effects that can come up. So we always advise you to strictly monitor your patient for any adverse reaction.
So how do we dispose chemotherapy waste? If the chemotherapy medication was administered, how do you advise that the waste be disposed?
Okay, we have various methods for that. There's a psychotoxic waste bin where you dispose the sharp equipment, the needles for the infusions, where you can dispose them, and also a special disposable bin for the gloves, the aprons, the head covers that were used during the administration of this medication.
Just like the lead bin.
Yes.
Yeah, I think I've seen something like that around the hospital. I want to also ask, what are the effects if someone is exposed to chemotherapy medication? You mentioned earlier that cytotoxic drugs are those drugs that kill the cancer cells. So if these drugs can kill a cell that is immortal, a cell that does not die, how much more what it will do to a cell that can die? So what are the effects one would expect, or if one is exposed to chemotherapy medication, what are the effects of being exposed to chemotherapy medication?
Okay, so for chemotherapy medications, unlike our normal medications used for other illnesses and sicknesses, chemotherapy medications are very delicate. They affect both cancerous and non-cancerous cells in the body. And then for the individual who does not have cancer, might think that they are not at risk, but truly there are so many risks to it. Okay. So it can cause infidelity for the males and the females, and also secondary cancer. What do I mean by secondary cancer? This individual does not have cancer, but later on, due to continuous exposure, can develop cancer
due to mutation of their genes.
Mutations of their genes, because it is affecting the cytotoxic. Like I said, it kills cells. Okay. So it might cause cell mutation and then cause other cancers along the way. Also, for temporary exposure, it can cause hair loss and allergic reactions for the respiratory tract, through the nose, the mouth, irritations, and then this individual might not really suspect that it is the exposure to these drugs, because they are thinking that it's just the normal medications that they can give at any time, but they don't know that these medications have severe effects to them. So it's very important to let the community know that cancer medication have serious adverse reactions both on the patient and then their relatives.
Okay, yeah, I remember a relative once complained of allergies. She was just by her relative bedside who was receiving chemotherapy, and she was trying to help the relative get something. I don't know how the medication spilled on her, and immediately she had a reaction on her skin. So it could also cause allergies, I think, also. So what should one do at that instance now, where there is an adverse effect of chemotherapy medication, or when one is accidentally exposed to chemotherapy medication? What should one do at that point in time?
Okay, so if the individual is within the hospital vicinity, he or she should call immediately for medical attention. So the individual will be examined. If it's something on the skin, then we'll quickly find an antidote to that.
Okay.
Also if it's also for the respiratory tract, maybe you're experiencing nausea, vomiting, you can be administered with antibiotics, emetics that you can use, and also monitor you to check your vitals. You know, the basic emergency responses will be carried out on that individual.
Wow, that is very interesting. Thank you so much, Nurse Gift. This is almost the end, but before we finish, I'd like to ask you, as a nurse, what are the nurse's role in the handling of chemotherapy medications?
Okay, so generally in cancer treatment, it's a multidisciplinary activity. We don't do it alone. We have the doctors, we have the med labs, the pharmacists who assist us in making sure that our patients are receiving the care that they deserve. So as a nurse, first of all, I feel that education is very important, because if the patients are not inclined, they are not informed that these are what to do, they might get it wrong. Because cancer medications are not only given in the hospital. There are times that they leave us for a short while to continue with their various activities in life, and then we don't know what is happening back there at home. So it's very important that we, the nurses, we should properly educate our patients and their relatives or caregivers on the various steps to carry out during this medication when they are not around us.
Okay, so around the hospital, that is for when they are going around the hospital. What are our own goals in the hospital?
So our goals in the hospital is we monitor our patients. We need to be by the bedside of our patients. We don't need to be negligent. We don't need to think that. Don't assume during your care for a cancer patient. Never assume. Always be around them, especially if they have pains. They might experience pains, and pain is personalized. So we also need to take note of our patients' complaints. Don't assume that they are fine or they're going to be fine, or because Mr. A reacted different way, you're expecting the reaction of Mr. A to come to Mr. B. Each individual breathes differently. So we should always take the individual's build up and make sure that we carry out their care efficiently.
Okay, so finally, what final words do you have for the public regarding safe handling of chemotherapy medications and cancer in general as well?
Okay, so cancer in general, cancer is not a death sentence, and like I said, it is not a big deal. There are so many misconceptions of this disease that makes it kills the individual more before the disease itself. So the general public, please, I need you all to be relaxed and be calm. Anxiety kills faster than any illness itself. So as an individual, if you're diagnosed with cancer, meet your health professionals, your doctors, your nurses. Be as calm as possible, and they will enlighten you on what to do during your treatment processes. And also for the safe handling of these medications, like I said, they're cytoactive. They can destroy both harmful and normal healthy cells. So we always need to make sure that the precautions that were given to us, the instructions that each of our health providers, the doctors, the nurses have given us, we need to follow it diligently. Always report for adverse reactions. Make sure you carry out safe hygiene, proper hygiene. Wash your hands before and after your medication. Eat properly. Then also when using the toilet, flush up, because these medications can diffuse into the air, so you don't know when it's moving. So make sure that you are doing everything in a clean and comfortable environment.
Thank you so much, Nurse Gift. I'm so glad to have you here today, and I'm so happy that we have had this session. And to you, I hope you have learned something today from the safe handling of chemotherapy medications. If you have someone around you who has been diagnosed with cancer, who is receiving cancer treatment, remember personal hygiene is very important. Hand washing, flushing of the toilet at least twice before use by one who is not receiving chemotherapy treatment is very important. Safety is everybody's business, and when you are safe, when we are safe, we work together for a better society. Thank you, and see you in our next episode. Until next time, bye.